I am an emergency physician, a board-certified ER doctor, and I've spent my entire career consistently taking care of one thing. It's not emergencies. It's barriers to care. So we're going to unpack barriers today. What is a barrier? It's an obstacle. It's meant to prevent access, and they are everywhere, especially in healthcare. And I'm going to tell you a story of a real patient and their barriers to care. See if you can relate. So Mark is turning 50, and he's going to get his health back on track. He has a good job, he has insurance, and he hasn't seen his doctor in 2 years. He's got high blood pressure and high cholesterol, but this is his year to do that. So he calls his doctor's office to make an appointment, and they tell him, sorry, we don't take your insurance anymore. You got to find a new doctor. So Mark goes back to the drawing board, and he looks through his plan, and he finds his new assigned provider, and he gives them a call, and they are very excited to see him in 4 months. So Mark is in a predicament. What do you think he does? Nothing. He does nothing. And the reason why is because of work, family, finances, the stressors of life. He forgets about it. And life goes on without his medications and without proactive care. And these are the barriers to preventative care. Can you relate to any of that? Yeah, I thought so. So let's fast forward 6 months in time, and Mark actually finds another reason to seek care. He's sick. He's got a cough and a fever. He's had it for a week, and he's worried. So he calls this doctor again. And this time, good news, they can see him. They're going to squeeze him in tomorrow. But the nurse on the phone says this one thing, and they say, if you're really that worried, you should go to the ER. So now Mark's in a predicament again. He doesn't know what to do, so he consults his friend, Dr. Google. Right? You guys know Dr. Google? Yes. It's one of my favorite friends, Dr. Google. And Dr. Google says it's either nothing or you have dengue fever. And so Mark goes quickly to the ER. And there he will sit for hours. And during that time, he's going to have some imaging studies done, some blood work before he even sees anyone. Eventually, he's rushed back to a bed in the hallway. And a frantic doctor runs up to him and says, Mark, I'm your doctor. Good news, you're not sick. You have bronchitis, it's a virus, nothing to do. You didn't need to come here. But I'm very disappointed in you because you should have seen your primary care doctor. And you should be taking your medications. Now get out of my ER. And kicks him out, right? So I'm paraphrasing a little bit, but I've done this to patients in some form or another. And Mark's chart is going to say that he is non-compliant with his medications. A month from now, he's going to receive a bill for $5,200. And because he has a high deductible health plan, he's going to have to pay for that out of his own pocket. These are the barriers to immediate care. Does any of that sound familiar? Yeah. So we're going to fast forward 12 years in time, and the last decade has not been kind to Mark. Mark lost his job a while back. He lost his insurance, and he has developed some pretty serious illnesses. He has liver failure, and he has kidney disease. He needs specialty care. He needs constant treatment. He needs resources. And for a while, he tries very hard, but the cost of care and the complexity, it's just too much. And so begins a cycle of ER visits, hospital admissions, nursing homes, setbacks, over and over and over again. And his adult children, they try. They really try to help, but they can't even navigate this system for him. So at the age of 64, alone in an ICU bed, 1 year away from Medicare kicking in, Mark passes away. Layers upon layers of barriers. Mark was my dad. And I really wanted to help him. And even as a physician, I was lost in this system. It's easy to see why the ER is the only reliable place of care for so many people. Lack of immediate care, lack of prevention, and all of these social factors that influence our health. Okay, I'm going to take a deep breath here. And there is optimism here in this talk, I promise. So how do we break these barriers? Because we need to break them. So first, we have to change how we access immediate care for everyone, not just for some. Now, if you have insurance, you likely have access to care management or even telehealth. But what if you don't have insurance? Here in this city, in Jacksonville, we are doing something really cool. We have a program that provides every person who does not have insurance with 24/7 access to a virtual emergency doctor and care navigators and nurses. It is an innovative program called HealthLink-Jax. I love this program. All you have to do is call 925-CARE, a simple phone number for any medical problem. You will be immediately connected with a physician and a nurse to help you follow up for the next stage of care. In our first week of launching this program, we saw someone who had been to the ER 26 times this year. Do you know how many of those visits were avoidable? A lot of them. Now, the city is funding this program. It's got bipartisan support. City council, the mayor, the leadership. Why is that? The answer is very simple. There is a real financial impact to helping people stay out of the ER. And actually, in this county, the average cost of an ER visit is over $4,000. $4,000. Our goal is to see 10,000 people a year and keep those people out of the ER and get care elsewhere. And if we do that, that's $40 million in healthcare costs avoided. And we're well on our way. But it's not enough to just provide immediate care. We're actually helping people find a medical home, and that leads me to the next barrier. We have to improve access to prevention, to preventative care. Now, more than anything in this country, disease is killing us. It is completely preventable. And as an ER doc on a busy shift, running around, taking care of patients, I may have 1 minute to talk to a patient about what's wrong with them, how I'm going to treat them, and what they need to do after they leave. It's not enough time. And sadly, that's probably the only doctor they're going to see all year. Now, there are solutions for this. One of those is an amazing organization right here in this city called Jax Care Connect. And that organization works with every safety net clinic in the city, and they provide care management, referrals. They help people establish appointments with specialty care, with a medical home. I love this organization. And in fact, every patient we see at HealthLink-Jax that needs follow-up care, we refer to Jax Care Connect. And it's not enough even to provide all of these solutions. The care is great, but we have to start a lot sooner. And that leads me to the last barrier. We have to address social determinants of health. Now, if you're not in healthcare, you might not have heard this phrase, social determinants of health. But these are the non-medical factors that influence your health. How much money do you have? What's your education level? Do you have access to healthy foods? Do you have a car? What's the color of your skin? My dad, in the last year of his life, his health declined pretty rapidly. Why was that? Well, he was living alone, isolated. He was uninsured, unemployed. He was struggling with depression, wasn't eating healthy food. These are not problems that a physician can fix, and each one is extremely complex on their own. Thankfully, there are organizations that work on this, right? There are solutions out there, and I'm going to name a few in this city again. Feeding Northeast Florida provides healthy food for thousands of people in the city. Rethreaded provides employment and social reintegration for human trafficking survivors. Soulsbacker Clinic provides care and housing for the homeless. My point is, we have all of these amazing solutions, and yet, 5 miles from where we are right now, the average life expectancy drops from 81 to 68. It's 13 years of life lost. 13 years. I just want that to sink in a little bit. So, what do we do about that? The good news is we have solutions. And public health programs have looked at this. And in fact, one of my favorite studies looked at 150 public health programs. And they found a common factor in very successful programs that changed outcomes. You know what that was? It was collaboration. So here's the optimism back into this talk. Collaboration. No single organization is going to solve this problem. Everyone has to come to the table. Now, HealthLink Jax, our program, is a collaboration of a motivated city government, 5 health systems, safety net clinics, nonprofit organizations, and for-profit organizations. Each one solves a different piece of the puzzle. Each one breaks a different barrier. And when this study looked at these highly successful programs that were collaborative, they went a step further. They asked the leaders of these organizations, and they said, "Why do you think you were successful?" And they found another common answer. It was trust. These leaders, these organizations, they trusted each other. And I'll break that down for you. It was more than just sharing a common mission together. They had built relationships long before they were needed. So again, I go back to my dad, back to Mark. What if he had had access to this kind of collaboration? Could he have met my wife? Could he have met my kids? Would he have just had a more graceful departure? So this is your call to action. Don't wait for an opportunity to come to you to make an impact. Go out now, go across the street, go across the aisle, across the river, and build relationships long before you need them. And then, when an opportunity comes, we will all be ready to make an impact. That's how we break barriers. Thank you.